and just let me know when it's live. So the meeting's now streaming on YouTube. Councillor Holditch, if you'd like to commence, please.
Thank you very much. Good morning, everybody. Welcome to the meeting of the Cambridgeshire and Peterborough Health and Wellbeing Board, Whole Systems and Joint Subcommittee. I would like to start by welcoming those members of the public and press who are watching the live stream of the meeting through the Council's YouTube page. Due to government guidance on social distancing, the meeting is taking place remotely in accordance with the legislation laid out in the local government, police and crime panels, COVIS Flexibility Authority and the Police and Crime Provision Panel meetings, England and Wales Regulations of 2020, which makes provision for remote attendance at remote access to these meetings. Meetings also followed the City Council's virtual meeting protocol. In order for this meeting to run smoothly, I ask several things from members participating. Firstly, would you please keep your video on at all times with your microphone muted except when you're invited to speak. The Democratic Services team will be monitoring the participants list to see if anyone has dropped out of the meeting and will try and contact you to provide assistance about rejoining the meeting should this happen. As with all new systems, we may run into technical problems, and for this I ask for your patience. Should this occur, the meeting will be adjourned and will be declared as a fault is addressed until the fault is addressed. The public broadcasting will be paused, and if not possible to solve the issue, the meeting will be adjourned until such times as it can be reconvened. Finally, I would remind members that all virtual meetings are recorded. And before we move to the first item of the agenda, I would begin by asking Democratic Services Officer Paulina to conduct a roll call of board members to establish your presence. When your name is called, would you please unmute yourself and confirm that you're in attendance? Thank you very much. Paulina.
Thank you, Chairman. So apologies for absence have been received by Councillor Cryan, and Councillor Robinson is in attendance as substitute. Tracy Downing and Scott Halliday is in attendance as substitute. Also received apologies from Stephen Poisey, Jan Thomas, Joanne Proctor, Matthew Wynne, Councillor Huffer and Councillors Jill Watkin-Taberner. I've also received apologies from Matthew Wynne. Thank you.
Okay, thank you, Paulina. Before we move into the first item on the agenda, please can I remind participants, if you wish to ask a question or make a comment, then you must raise your virtual blue hand, which is located at the bottom of the participants list. I will then invite you in order when you raise your hands and then ask you to speak. Please unmute your microphone and make your comments or questions and then mute yourself again. We will now move to item 1, which is apologies for absence, which I think probably you just did you not, Pauline, or do you want to do it in sequence?
I've done apologies absence, but I need to do a roll call.
Okay.
Shall I? And I'll do that for you, Chairman, shall I?
Yeah, please, yeah.
Okay, thank you. So if I could do a roll call, and if you would kindly unmute the microphone and let us know that you're present at the meeting, please. So Councillor Bywater, sorry, Councillor Bywater.
Present and correct, Chairman.
Councillor Fitzgerald.
Yes, I'm here, thank you.
Councillor Harvey.
Present.
Councillor Howell.
Present.
Councillor Hoy.
Here.
Councillor Jones.
Here.
Councillor Massey.
Present.
Councillor Robinson.
Yes, present.
Councillor Susan van der Ven.
Present.
Councillor Walsh,
Yes, I'm present. Thank you.
Councillor Warwork.
Yes, hello, present.
Officers and partners, please could you confirm you're present at the meeting? Wendy Oger-Wellborn,
Present.
Dr. Robin,
Present.
Charlotte Black,
Present.
Scott Haldine, who's substituting for Tracy Dowling.
Present.
Claire Higgins will be joining us later, I understand. Dr. Howson,
Present.
Julie Farrow,
Present.
Louise Mitchell,
Present.
Val Moore.
Good morning.
Sorry, was that Val?
Yes, hello,
Oh,
present.
right, sorry, you were very faint, Val. Joan Skeggs, who's substituting for Zephan Trent.
Present.
Caroline Walker. Caroline Walker. I can see Caroline's with us, but she's on mute. I'll move over to Ian Walker.
Yes, present.
And we have Jane Wisely, who's in attendance as an observer. Are you present?
Present.
Thank you. That's everybody that's here, Chairman, if you'd like to continue.
Right, thank you, Paulina. So the apologies are now.
So apologies for absence are Councillor Kyam, and Councillor Robinson is in attendance as substitute. Tracy Dowling, Scott Halladine is in attendance as substitute. Stephen Poisey, Jan Thomas, Zephan Trent and Joan Skeggs is in attendance as substitute. Joan Proctor, Matthew Wynne, Councillor Julia Huffer and Councillor Jill Watkin Taverner. Thank you.
Thank you, Paulina. Members, do I have any declarations of interest? As I can't see anybody wishing to, can I take that, Paulina, there are no declarations?
No, I can't see anybody with raised hands. Thank you, Chair.
Thank you. Now we move to item 3, the Cambridgeshire and Peterborough Local Outbreak Control Plan. I would like to welcome the following officers who are in attendance to speak to this report. Gillian Beasley, Chief Executive, Cambridgeshire and Peterborough City Council. Christine Birchall, Head of Communications for Cambridgeshire County Council and Peterborough City Council. And Sue Grace, Director of Customer and Digital Services. Also, Dr. Tony Jewell, Consultant Head of Medicine. Well, welcome to those. So would you please now, Officer, introduce the report? I think that's going to Liz, is it now? Not quite sure. Yes. Because Liz was off sick last week. So Liz, is over to you.
Thank you. Okay, so the Local Outbreak Control Plan describes the work that we'll deliver locally as a system in our part of the national test and trace model. It's absolutely critical that we get this right and have the processes in place to identify and manage local outbreaks of COVID-19 as part of the gradual relaxation of lockdown. And I would say that test and trace and local outbreak plans are necessary to move back towards our new normal, but they're not sufficient. We need to continue to observe the social distancing measures that the government and hygiene measures that the government is asking us to do. Test and trace is part of this. Our local plan is due for submission to national government tomorrow, and we've been allocated approximately £3.5 million across Cambridgeshire and Peterborough to deliver it. One of the principles of the local outbreak plan, and I'm really pleased to see that this has been recognised nationally, is that it should build on existing local systems to protect health and manage outbreaks of infectious disease. And to do that, we work across the Public Health England Health Protection Team, which is regional east of England, local authority public health teams, environmental health officers and others. So we have these local systems which we use to manage TB, which we use to manage norovirus, meningitis, all sorts of other outbreaks. And there's been recognition that these systems are strong and that we can build on them to manage COVID-19. And I'm really pleased about that. So you have the plan in front of you, and the planning process and the plan is extremely valuable, but emergency planning officers would say that 10 minutes into the battle, any plan may not go exactly as expected. So I'd like to go into a little more detail about how the plan has been prepared, because that is very important in terms of the reality of how we address local outbreaks of COVID-19. So we started our planning, and this was first announced back on May the 22nd, by bringing a group together, multi-agency group, to identify the work that needs to be done in order to deliver effective local surveillance of COVID-19 and effective control of local outbreaks. And we also identified the organisations and the key people who need to be involved. So very early on in the process, we set up our multi-agency health protection board. And under that board, we set up multi-agency work streams working across council directorates, Public Health England, environmental health, education leads, care home leads, and so on. And examples of those are our surveillance work stream, how we look at trends and things that the data are telling us, a testing work stream to make sure that we have absolutely the right plans, practical plans in place to implement testing when we need it and get results quickly in the right place, and work streams to plan for outbreaks in different settings. So we had one work stream for care homes, another for workplaces, and so on. We gave the work streams clear direction of what they needed to achieve, and this was very much about, in Cambridgeshire and Peterborough, this is very real, it's very serious, we all know that. What issues do we need to sort out to make this work in practice? So what this means is that key people from different agencies have been together establishing what they will actually do for nearly a month and a half now. And in reality, these relationships will enable us to be flexible and responsive when the national or local picture changes, which no doubt it will do. We know that national guidance will change. So it's been a huge team effort. We've had involvement from all our district councils, from the clinical commissioning group, from directorates across the council, and of course from Public Health England. And a huge amount of work has gone into creating this plan and what underpins it. The end result of our work streams wasn't the plan that you see before you. It's a 75-page document that identifies the key issues for the work streams and the timed actions needed to address these. So a very practical plan, but in places quite technical, in places quite repetitive, and definitely not the right document to communicate with the public. So what I'd like to do is to thank Christine Birchall, Tony Jewell, and Sue Grace in particular for the excellent work that they've done to translate the more technical plan that we'd created as officers into a public-facing plan, which we believe is clear and understandable. And that's been a very good piece of work. So huge thanks to the very wide team across the council and across organisations in Cambridgeshire and Peterborough, which have brought this together. And really, you are seeing the headlines. Communication will continue to be critical, communication with the public and with stakeholders. And I'd particularly draw your attention to the proposals in the covering paper for a member-led local outbreak engagement board. You'll be pleased to hear, as Health and Wellbeing Board members, that this has been formed around the core joint subcommittee of the Health and Wellbeing Boards, but with appropriate additional membership and with the opportunity to co-opt a local member if there's a local outbreak. And the purpose of that board is not a decision-making board, but a board to meet in public, provide public engagement, public communication, and appropriate community reassurance. So that's my introduction. I don't know if other officers who are in attendance would like to add to that.
Thank you, Liz. Nice to see you back firing on all cylinders. Mrs. Beasley, do you want to add anything to that?
No, Chairman, I'm fine with that introduction. Thank you.
Any other officer? Take that as a no. So members, questions, please. It's all gone quiet. Oh, we got one. Councillor Jones was up first. Linda Jones.
Thank you. And thanks for the introduction, Liz, because I think that really important statement about the fact that this stage is a recognition of local experience and capability needs to be reinforced. I mean, I was hoping that would have been the case much earlier on, and I think we might have done rather better, but it's very good to see that happen now. It's very good to hear about how the plan is built on existing work streams, and it's very good to hear that behind the public plan is a much more detailed technical plan. And finally, it's very good to hear that the board will meet in public, because I think public accountability and transparency is very important. I have got a few questions to ask, if I may, in relation to the cover paper and to the plan. One is about, perhaps I'll just ask the questions and then, hand over to you, as it were. One is about the timely manner. There's a discussion about timeframes, reporting in a timely manner. A timely manner is clearly absolutely essential in terms of combating this, getting to people affected very quickly, locking down where it's needed very quickly. So I'd like some clarification on that. The second one is funding, because I know that Cambridgeshire and Peterborough haven't been the worst affected areas, but the initial 2.5 million funding for Cambridgeshire, I didn't know whether that was a finite amount, or whether, if, for example, there are unexpected but considerable outbreaks, whether there is a further funding stream available. The third one was about the equalities issue, which is raised in paragraphs 5, 6 to 9 of the cover paper, and again raised then in relation in the plan itself. And you talk about equalities and meeting the most vulnerable groups, but actually the issue about Black and ethnic minorities is not necessarily they will be in those the vulnerable groups that you identified. They will be across the population in possibly particular areas of the city or the county. But I didn't understand, and there may be something underneath the public plan. I didn't really understand the strategy for mitigating and minimizing the risk to those groups. The next one is about testing capacity. And are we confident in 2.2 of the plan? It talks about testing capacity. Are we confident now that that is adequate for our needs? And that is clearly important. And the final one on page 15 and 16 is about sort of reporting. And I wasn't entirely clear whose responsibility it was to report. Is this reporting something that you expect a business to do, to report that they may have an outbreak? And we're back to the issue that I did raise in Health Committee last Thursday, which is that I understand at the moment that Public Health England, the national government, is only giving postcode information. And in urban areas, which are quite densely populated, that may not be enough to identify what the outbreak is. So I think we need to kind of understand that too. Thank you very much.
Thank you. Liz, are you able to take all those, or will you delegate?
I'm happy to take the first two, and then I'd suggest Tony Jewell responding on the equalities and Black and minority ethnic groups, because Tony Jewell has done quite a lot of work on that. Testing capacity and reporting, again, I can respond on, but the other officers who are in attendance, I hope will chip in as necessary. In fact,
you're warm, Tony. Tony, you're on guard.
Okay, so in terms of timely reporting to combat the virus, We're very aware that speed is often of the essence, having watched the infection rates grow very quickly back at in the earlier phases of the pandemic before lockdown. So in order to facilitate timely reporting, the reporting within our local system is to the Public Health England Health Protection Team from the Test and Trace system. We have put in place mechanisms to ensure rapid reporting from Public Health England through to local authority public health at the County Council. So we've set up a single email address, single reporting line, and the information flows from Public Health England have improved dramatically over the past 2 weeks. We have a daily surveillance cell meeting at 9 o'clock, which involves the clinical commissioning group, business intelligence team, the local authority business intelligence, public health intelligence, and chaired by a Deputy Director of Public Health, that analyses information that is coming in from Public Health England and other national sources, which comes in on a daily basis and is usually official sensitive. It also takes information that is coming in through council routes, such as information on travel, cars, bikes, social distancing. And it also takes in the daily sit rep from the CCG, which tells us what is happening in the NHS, which is sometimes a good early warning system as well. So the surveillance cell looks at that information daily, identifies any issues where the data looks out of sync, and identifies trends, and then takes action on those. So it feeds the information out to the appropriate groups and work streams. As one example, if they are reported by Public Health England an outbreak in a care home, because the care home will phone the health protection team, Public Health England, directly if they suspect an outbreak, that information from Public Health England will come through to the surveillance cell, and the surveillance cell will send it on to our care home cell, which looks after all our care homes in Cambridgeshire and Peterborough, to ensure that our local authority social care colleagues and our CCG colleagues who look after the care homes and help them deal with outbreaks have that information. So that's the same for workplaces going through to District Council Environmental Health. It's the same for and education. It's the same going through to various different settings. So we have this daily surveillance cell, and now this single point of contact alongside it, which enables us to process the information as quickly as possible. Linda, does that answer your question, or were you aiming at something slightly different?
No, that's very helpful. Thank you very much. I'll let you go on.
Okay, thank you. So on the funding, this may be one where Gillian knows more than I do. So please do come in, Gillian, if you know a bit more than me. We received the funding allocations with some fairly basic conditions around the funding. There have been questions about the time span that it extends for, whether it's to the end of the financial year. That's an assumption we tend to be making. But as with many tranches of funding which have come down from central government to address COVID-19, I think we get the funding, we're expected to use it, but we don't necessarily have a roadmap for the next 2 years or even the next year necessarily in terms of any further funding that may come in. I would hope that if there was a very major issue in Cambridgeshire and Peterborough with potential national implications, that there might be other sources of national funding to help deal with that. But Gillian may or may not know more about this than I do, so I'll hand over to Gillian at this point.
Thank you, Liz. You've accurately represented the position. What I would say, though, in addition to what you said, is that what we will absolutely do is make sure, obviously, that we devote the funding that we've been given to the plan that we're trying to implement. But what we've got a good track record of is actually identifying what we might need going forward. So I would say that this gives us a good start. It gives us resource to apply to the plan. But what we will absolutely make sure we do is log any costs or future costs that we think, and we will use the sources that Liz has got, I've got, and as politicians you've got through our MPs to advocate for more funding, because of course this is only start-up funding, and we know that the Outbreak plan is not a start-up plan, it's an ongoing plan that's going to be with us for some time. So my view of it is we'll keep the discipline to spend money to make sure we get our outbreak plan implemented. But we will absolutely make sure that we identify costs going forward, and we will advocate for those costs being applied as we go forward. So we're on top of that, and we have a way to do that, but we may need to use political routes to help us identify future funding.
Thank you, Gillian. Tony, are you ready? Tony, Jill?
Yes, good morning, everybody. Yes, I was involved in producing this local outbreak plan while Liz was away. And before that, had been picking up the BAME question when there became national publicity about the increased risk that the BAME community have with COVID. And we refer to that in paragraph 5, which is the initial paragraph before each of the settings is referred to. And in that and I will quote from it, says, all these specific groups take account of vulnerability factors in their populations, such as age, people living in more deprived communities, certain occupations, and those with BAME heritage. And that is essentially, as we've begun to learn more about COVID, right from the beginning, we knew that it particularly affected older people, and particularly affect male more than female. Was obviously a risk in institutions such as care homes, but also obviously healthcare settings. But evidence started to emerge that BAME community were particularly at risk, and national work has identified some of the factors that underpin that. And some of them are generic deprivation factors. So we know there's a very strong link between deprived communities and their risk of getting severe effects from COVID. Also occupations where working from home has not really been an option, where people have had to continue to work on essential services, but also work that they required to take buses, trains, travel to work. And those jobs where there's been face-to-face dealings with the public or clients. So we, particularly in Peterborough and Cambridgeshire, realize the risk of taxi drivers, for example. So people in an enclosed space, for taxi drivers being exposed to potential symptomatic people. So basically, in terms of a strategy going forward, what we're outlining here in this section 5, there is reference to healthcare settings where we know there are a lot of BAME employees in the NHS, and the NHS has got risk assessment advice to their HR departments. We realize that workplaces, as I've just said, some of the workplaces have extra risk, vulnerable groups, as I've mentioned, and then the final one about supporting residents and communities. So I think the way going forward is for us to understand these increased risks and make sure that the local community hubs and the local community organizations are part of this whole system that Liz described. So it's early days. We recognize the increased risk. We've noted it in the outbreak plan. And what we now need to do is come up with some actions that would take that work forward. So thank you.
Councillor Jones, does that answer all your questions?
Could I just come back on the that issue to Dr. Jewell? I'm sort of interested. He mentioned taxi drivers, and he's quite right. I mean, across the city we have, and indeed across the whole of the county and Peterborough too, there are a lot of taxi drivers who are self-employed, and making the adjustments themselves. I mean, for example, New York taxi drivers routinely have screens, and so do some of the recognised London cabs, for example. But if you're a private hire, then you're not going to have a screen. Is there any funding around within this prevention part of the local outbreak control for any support for that kind of intervention in relation to a group like taxi drivers, which is fairly high risk?
Tony?
Can I come in, Jim? Yes. Yeah. So we issued some guidance for taxi drivers across Cambridgeshire and Peterborough. And much of that guidance are things that are relatively low cost. So this is about advice on face coverings, advice on making sure that people getting a taxi or booking a taxi are asymptomatic, making sure that the drivers clean the taxi, the hard surfaces, use contact payment systems and so on. So much of that was not expensive and was part of good practice. But you're right that for taxi drivers using an ordinary saloon car, they do not have the normal, that partitioning that you would see in a black London taxi, for example. Some employers and fleet owners have paid for partitioning to be put in the taxi, but I don't think that's widespread at the moment. I don't think there is any earmarked funding to support self-employed taxi drivers to do that, and that is probably the most expensive item so far. Thank you.
Thank you, Tony. Councillor Bywater. Councillor Bywater. Go on, have you finished?
Chair, could I just come back? Because there were two other questions. I do beg your pardon.
Yeah.
I know I asked rather a lot. One was on testing capacity and one was on the reporting side, which I think Liz was going to answer.
Yes, she was trying to get back in. My apologies.
Okay, thank you. So testing capacity and is this adequate for needs? What I would say at the moment is that there is more testing capacity across the national and local systems than the number of tests that are needed at this point in Cambridgeshire and Peterborough. So there is some underuse of the capacity, and that's a good thing because we are at a low level of COVID-19 in the population at the moment. So we need, if we start to increase the amount of COVID-19 in the population, then we will need that additional testing capacity, and it's good to know that it's there. And that's particularly in the national testing capacity. There is quite a bit of additional capacity there. The concern locally is not so much about the overall capacity, but it's about being able to get tests done in the right place at the right time and get the results turned around quickly. So overall, just to reassure people, the results are now being turned around much more quickly on testing from both the national and local systems than in the past. So 24 to 72 hours, and it's improving all the time. And we can get local tests done within 24 hours. The issue now is more if we are dealing with cases in populations who don't drive, who may not have the internet, or if we are dealing with an outbreak in a setting where we want all those test results collated together very quickly. What we've identified is that we want to be able to mobilize that rapidly. Probably the best rapid local testing capacity at the moment is in two places. The service commissioned by the CCG, Commissio, which can go out very rapidly to outbreaks in care homes, send tests to the local labs and get those turned around very quickly. So Commissio is able, and it has helped us in some other situations, for example, prisons or homeless hostels. Commissio is also rapidly swabbed and tested there. The other thing that can be done when perhaps more swabs are needed is the military-led mobile units. And the latest information I've had on those is that if we want to screen quite large numbers of people, unusual setting, that can be mobilized within 24 to 48 hours. That was a report I got back this morning. So we are very much on the way to getting there. We believe that we may want to commission some more local testing capacity alongside the CCG, just to make sure we're absolutely fleet of foot for whatever our local outbreak situation is. But we're also very mindful that the military mobile unit capability is increasing dramatically and improving. So I think the answer to that, Linda, is yes, the capacity is there at the moment. The issue is the speed, and the other issue is making absolutely sure that all the results from these different testing sources get back to us very quickly in the right way, because there is some complexity in where the test results from different system goes, but we're working very hard on that, and there have been very significant improvements over recent weeks. So a positive picture, but we will continue to absolutely monitor and pin down on that. On reporting, Linda, is that anything you want to come back on testing? No. Okay, on reporting, you said you weren't clear whose responsibility it is to report, particularly from businesses, and there are some concerns that we don't get information locally on the postcode of the business. The reporting responsibility, I think, needs to go quite widely. So in most cases, the reporting starts with individuals who have symptoms contacting the National Test and Trace, getting tested, and then we are finding that through the National Test and Trace system that some businesses' outbreaks are being identified. And people may not have really made clear to their business why they were off. It varies. I think businesses should report if they're aware of an outbreak, and part of our work stream on outbreaks in workplaces is to absolutely make sure those communication channels are there, and that businesses feel that they can communicate with us whenever they want to, because it's better to have multiple channels to ensure that reporting gets through. So I would suggest if there's a problem, it needs to be reported. In terms of information that we are really just at the start of getting through on test and trace, and this is obviously coming to us with a high degree of confidentiality. Linda, you are correct, and this is an issue which has been raised nationally, that we get postcode information, but we don't get postcode information for place of work, and that runs a risk that you don't immediately identify a workplace outbreak. There are certain safeguards within the national system on this, but what I can say to you on that, Linda, is that this is an issue which is being addressed very actively at various regional and national forums, as well as locally, and we absolutely will continue to ask for and escalate anything that we need in order to deliver our local outbreak management in the most effective way that we can. So yes, reporting needs to be from whoever has the information, and we will very much support the regional and local work to ensure that workplace postcodes are in the system and we know immediately when there is a workplace outbreak.
Thank you, Liz. I think that covers all of Linda's points. Councillor Bywater.
Thank you very much, Chairman. Good to see you back, Liz, and thank you very much for this report and the other officers that have prepared it. Liz, you talked about communication being critical to the public. I know, just to remind members and people of the board, that I'm here as a district council representative for Huntingdon. And given the issues we had in Huntingdon a few weeks ago in regarding communication, I think I just need to understand the links this paper has into the community, the communication aspect of it, and how it supports residents. Because ultimately, you suggested that the member board would have local representatives. How quickly that would sit alongside the actual operational side of things? You know, the board can come together at a relatively slow speed, and yet, you know, ultimately we'll have to be perceived to react very quickly. And I'd just like to understand that, really.
Thank you, Simon. So the public communication and engagement around this whole agenda is absolutely critical. It was the public that stopped the first wave of COVID-19, because it was the public behaviours in observing the lockdown rules that made all the difference. And there was a little bit of enforcement, but most of that was because people understood the issues and behaved in the right way and did the right thing. So that is when all that we have is public health measures. We don't have the vaccine, we don't have, the treatments are improving, but we don't have a treatment. It is absolutely those public health measures of how people behave that are going to make the difference here. So I couldn't agree more that this is essential. We have a communication strategy that was for this work. That was one of the first strategies produced, very ably led by Amanda Rose and Christine Birchall. We have a piece of work that Adrian Chapman has done around mobilising the community appropriately when there is an outbreak that is very clearly community-based. We have to be a little bit careful here, because some outbreaks are very setting specific, And it's not that the infection is spreading in the community, it's that the infection is spreading within a very specific setting. And that is best dealt with by working really hard with the setting to stop the transmission. So there are different outbreaks which require different responses. But community understanding, trust and mobilisation when necessary is absolutely key. So I think there's a couple of things there. One is that because the board, the local member engagement board, is not a decision-making board, it can be called at 24 hours notice if there is a major issue. So it's not a formally constituted council decision-making committee. It is much more fleet of foot, and we've deliberately set it up like that. So we can use that board to communicate in the event of major community concerns very quickly. And although it is absolutely member-led, the board does also have officers like Wendy, myself, Adrian on it, and CCG members, so that we can give that, in a sense, technical reassurance when necessary. It's we've set it up very carefully and with district council involvement as well, to enable it to play that role. In terms of the information coming to us from various sources, what I do need to say is that we have to be quite careful here. That information is often supplied to us as official sensitive, and we have to respect that the people supplying it to us have laid those conditions on the information, while at the same time we want to be able to communicate appropriately with wider organisations, with members where appropriate. And we are setting in place, and in fact Gillian and I and others were discussing it this morning, we are setting in place very clear protocols which will be overseen by our information governance colleagues and others to ensure that we can communicate what we need to communicate in a timely way, and that we have very clear protocols to ensure that we can do that appropriately, that have been agreed by all parties. And that is outlined in the plan.
Christine, do you want to add anything to that? Christine, do you want to add anything to that?
No, I think Liz has explained it very well. I think one of our main tranches of communications is going to be on prevention, on measures that people can take, and being able to do that very simply and understandably for different communities. We've been doing a lot of work with the community champions. You may have seen that we've been sharing across all of our social media platforms a number of translations, and we are, I think, the only area in the country that's doing this at the moment, because we don't get these nationally. So we've got a lot of support from our community leaders from different groups, including Councillor Fitzgerald, who's also recorded some for us. So we're putting this information out, and what we're aiming to do is to do very specific bits of communications for different groups. So, for instance, for workplaces, for shops, for business owners, those sorts of things. So we will have bespoke communications for those areas as well, and also for different areas, different districts, that sort of thing.
Thank you, Christine. I see Simon's hand's gone down. Did all your questions get answered, Simon?
Yes, thank you very much, Chairman. Thank you.
Right. Councillor Susan van der Wen.
Thank you. Nice to see everyone. I have 3 sets of questions. The first one follows on directly from Simon. So I'm very glad, Simon, that you raised the local connection. I would split this into 2. We have the local engagement board, but to me at local level, it's not actually very local. It's pretty high level. And I think Simon was really trying to get at the very local connection. To start with, it would seem an easy thing to do to have a kind of a group leader representation on the engagement board, because it's actually does not have a very strong councillor representation. It's only at the very top. So I think if you want buy-in and real contribution from a wider field, you could get that. But more importantly, I'm I'm wondering about the role of the many COVID response groups in the communities at very local level that have demonstrated from the very beginning that they can act quickly, and they have acted quickly. And there are some very impressive structures around these proven groups, but it's not clear to me at all what their role is here. And this is maybe a missed opportunity. To give you an example, one local setting that we haven't really talked about, although we did mention the taxi setting, is contracted bus services. And that to me represents a specific community and a specific setting. And it is characterized by vulnerable users, often without internet, cannot drive. It's essential lifeline transport. And in my experience, in my own division, there's a good deal of confusion about protocols on buses and the mandatory use of masks. But then you get into the nuts and bolts of, is it required? Where do I get a mask? Where do you get a mask? So this is where things need to work at local level, and the COVID response groups could play a really helpful role here in information and liaison with the engagement board to deal with some of these issues. That's one question. The second one is some basic nuts and bolts on the settings that are described in the report. I wondered specifically about support to schools. I know that the report indicates that risk assessment templates have been provided to schools and so on, but there's a real capacity issue in the school setting for that senior leadership team, which has been constantly having to reconfigure the school to meet the changing guidance and requirements. And I think there is a capacity issue there that has an impact on learning, which I realize is not the subject of today's meeting, but there is a tension around school capacity. And I wonder if any of the government funding that has come down for this exercise is being deployed to assist schools in this very technical risk assessment work, or these protocols. Also in that realm, I wanted to ask for reassurance about care home settings, discharge from hospital where there's a false negative, and what the protocols are there that we can be sure about in the next few months. And then testing, Liz, you've talked a lot about the importance of speed there, but we are getting locally, anecdotally, I've waited 11 days for my test result. So it would be useful, again, at the local level to understand where this information should be channeled. So on the public facing document, I see there's a picture of somebody thinking, what do I do? And there's a little thought bubble. So I explored that thought bubble and I couldn't find the answer. So maybe that's something we can help feed in and complete that bubble. And then finally, I just thought it would be worth asking about Leicester as a sort of a dry run question, because I understand there have been some challenges by the mayor about protocols and authority. And I would imagine this is throwing up some useful questions for our own experience and our own, for this plan, and for understanding that the system has the components that it needs. Thank you.
Thank you, Susan. Liz, are you taking that?
Yes, I'm happy to take the questions, but also we'll ask Christine and others to answer on some aspects. So I think your first point, Susan, was about the composition of the the local engagement board. And just to reassure you, really, we have had a number of discussions about this and the best way to constitute the board, and have reached the current position after considerable discussion, including raising with group leaders. This is the one that we've reached. So absolutely hear what you're saying, but let's try it out and watch how it works, which I think will be effective. You also talked about the COVID response groups and their role, and the local district-based groups sitting under the district community hubs, and those are very important because with test and trace and with local outbreaks, more people are asked to self-isolate at very short notice. So people may find out quite suddenly that they need to stay at home for 14 days and not go out. Some people will be fine with that. They will be able to organise that food supplies, medicine, whatever, very easily. For more vulnerable people, it's essential that at district and local level, arrangements are in place to support people who are having to self-isolate, ensure they get their foods, their medicines, get their pet walked, whatever it is. So we think that there's a real role for those groups, and that is included in the plan. Though clearly perhaps needs more detail, but very important there. And you've also talked about how those groups could work on communicating other messages where there's confusion about things like mandatory use of face masks on transport. So I think absolutely, again, that work with those district hubs is led by Adrian Chapman, who's very close to very much part of the work on the local outbreak plans. So we need to get make sure those communication routes are in place. Is that helpful, Susan? I don't know if Christine wants to chip in on any of that around those local communications.
Christine, you want to come in?
Not on those, but I have noted the points about the thought bubble and where that relates to in the plan, and we'll pick that up after this meeting because we're having a look through the plan in the light of all of your comments today.
Thank you, Christine. That's useful.
Okay, so then Susan, you wanted some reassurance on school support. And certainly for schools, we have set up a schools cell to ensure that we communicate well and put the right measures in place when a school has an outbreak. And John Lewis has been doing a terrific job communicating with the school heads and making sure that they get all the information that they need about risk assessments, ways to keep their schools safe. And I do understand that many school heads are finding that there is a lot of guidance and a lot of requirements. So I do absolutely see what you're saying there. But just to reassure you that in terms of the local outbreak control plan, we have got those arrangements set up and in fact have standard operating procedures agreed with schools so that they do know exactly what they should do. Care home settings as well, and hospital discharge to care home settings. Again, I can assure you that there are now very strong protocols in place around that and a great deal of awareness of the issues and the need to quarantine. So that is the subject, and people from the NHS on the board may want to comment, possibly Louise if she's there, or Sue, but those, or Charlotte, those protocols are in place. So Charlotte or
yeah, I mean,
representatives, do you want to comment?
Happy just to confirm what you've said, Liz. There's clear national guidance around if someone's being discharged from hospital into a care home, and clearly sometimes this is someone going back to their own home, which is what which is what they want. So if a care home isn't able to confidently say they can isolate someone for 2 weeks, then alternative arrangements are looked at. But largely at this stage, the focus has been on making sure that we've got a really clear test result and a really clear care plan, that if someone is being discharged into a care home, either back to their home or a new placement, that everyone knows what's involved. And in some cases, it simply hasn't been possible. So someone will actually, in some cases, need to stay in hospital. We are in discussions across health and social care about whether we need to consider some sort of facility where people can be safely isolated for 2 weeks. But we've got a good collaboration with the hospitals, and I think we're working this out on a case-by-case basis, depending on individual circumstances at the moment.
Okay. Back to you, Liz.
Okay, thank you. So the next question was testing, and that there was still anecdotally local concerns about I've waited for a test for 11 days. And I'm very aware of those concerns raised some time ago before the full testing capacity and systems came on stream. If that's still happening now, Councillor van der Ven, certainly if it's an individual case that you're aware of that's just happened, then do please let me know about it. I'll put that into our testing cell and ask them to find out more, because that shouldn't be happening now. That's not the information that we're generally seeing, and we're getting a lot of comments on the test results coming back quickly. I think there's a more general question about when a resident has concerns where information should be channeled, and Christine has absolutely said that she will take that on board, and it's a very good point. And the public absolutely need to know where to go if they are waiting for a test result that they've expected and hasn't come. So we will take that into account. And in terms of Leicester and the challenges there, again, I think Councillor van der Ven, you make a very good point. There's been learning already from Western and the outbreak there. As we go forward with COVID-19, particularly as a new infection, which we are learning about all the time, we have to do everything that we can to learn from whatever happens. We hope that it won't happen first in Cambridgeshire and Peterborough, because then we can learn from the others and prevent it or mitigate it. But we absolutely need to learn where anything like this goes on. And I understand that there are the various questions about how this works, powers and so on. And we will certainly be discussing that, I'm sure, at regional and national meetings. Gillian, I don't know if you want to add on that, because I know you attend some regional meetings, Gillian and Sue, where you may want to.
No, nothing to add, Liz, nothing to add.
Okay, I think that covers all your questions, Susan, doesn't it? Take that as a yes then. Julie Farah?
Hi there, everybody. It was really nice to see you all. I just want to say thank you very much to the team for pulling this together. I think it's a really informative document, and it looks really good and meets the standard that I normally expect from the County Council. So thank you very much for that. I do have a couple of comments. I want to say thank you both to Simon and Susan, because they both picked up on the communication issue, and I'm going to come to that second. But the first thing I want to say is that in 5.5, you talk about actually engaging with the community and what you're going to do. And I didn't feel that was particularly strong here. I felt that one of the things that is missing is there's nothing in there about how you're going to reassure the community. Because I think whilst, you know, you've got a plan in place and they can read it if they want to, we need to have something in there about how you explain to the community about what's going on, how you can listen, or how you're going to listen to them, and how you're going to respond to what they're saying. So I think something in there revolving around community reassurance would be really good. That, as a suggestion from me, just reading through the document. And then I want to go on to talk about communications, because I think that we know, don't we, one of the things that we've got evidence of right from the start with COVID and about how our communities have responded, and they've responded immensely well. Liz made the point, didn't she, that without the community actually, you know, the behaviour of the community actually in lockdown, keeping to themselves, actually we would have been in a much worse place. And I think that actually communication here needs to be clearer about the link to community. And again, I didn't feel as though it was particularly strong. Now, I recognise that there's other documents that sit behind this about how you're going to do things. but because we've not got the detail and I don't know that, it would be really good if we could have some detail about how are you going to talk to the community and to voluntary sector or organisations about their role in moving forward, because we know that actually the voluntary sector and the community is going to play a major part in actually how we actually move forward with test and trace, but supporting community generally. So I'd really like to understand how that's going to work and what you're going to do, because I haven't got a sense of that at the moment.
Christine, I think they're mostly for you.
Hello. Yes, these were points that were picked up over the weekend as well. So, Julie, there's a meeting after this where very specifically the point about that you've made at 5.5 about actually how we're involving the community, how we're reassuring them, how we're engaging them, is very much something that we've said, yes, you know, we absolutely are, and we just need to strengthen the information that's in the plan.
Thank you.
So that yes, that will be picked up.
And the bit revolving around communications generally and involvement with the voluntary sector, because I mean, whilst you mentioned the voluntary sector and you mentioned community, it's quite light touch. I'd like to know how that's going to be strengthened, because we know that actually the more local you can do your communications, actually it gets through better, and actually it's quicker. We know we can access our communities really, really quickly, and I'd just like to see that strengthened some way, please.
Yeah, absolutely. And we are working very closely with Adrian. We're working very closely with the community reference group. So we have all of those methods in place to do that. We just need to be clear about it in the plan. And so I'll just give you my commitment that that's going to be picked up in the meeting that we have.
That's super. Thank you.
Thank you, Julie. Councillor Harvey.
Yes, thank you, Chair. I just wondered, sort of looking forward, I don't know if anybody else sort of felt this. I had a really sort of low few days a couple of weeks ago, and when I analysed why I was feeling so low, it's because I think mentally I'd prepared myself for sort of 3 or 4 months of this situation, and it suddenly dawned on me, well, actually this could go on for a couple of years. It's not unreasonable. And I wonder whether, in addition to planning, and I think this is an excellent plan, are we doing anything in terms of analysing people's attitudes? I'm sort of thinking a sort of almost a focus group kind of operation, asking questions such as, compared with your attitude in say April, May, how would you now view a request to comply with the kind of rules that we've been applying during lockdown? Because my sort of sense is that people are they're kind of fatigued, and I worry that when we come to sort of pull the levers that have been put in place, you might find the levers aren't actually connected to anything. It would be better to know that now rather than when the second wave comes.
Thank you, Jeff. Who wants to take that?
I can make a start if you'd like, Councillor Holditch.
All right, yeah. Be succinct, please.
Okay, so I do absolutely understand what you're saying, Councillor Harvey, and I think that this is something which the National Behavioural Science Unit to some extent predicted, that people could only cope with lockdown for a certain length of time. And so that mental preparation and those attitudes are very important. So there is something about communicating the real picture with the local population, just continuing that communication, making sure that we have as much of our resident population as possible on the same page and with that basic understanding of where we are in this pandemic, which is still sadly at a relatively early stage. I don't believe, unless Christine can come in with anything, that we have anything local of the sort that you described. I am aware that there are national surveys around what people are doing in their lives. So it is a bit more around what people are doing than around what they are thinking, but it is very much looking at people's lifestyles and to some extent what they feel about different social distancing activities. So I'm happy to identify some of those national surveys, Councillor Harvey, and perhaps send them over to you, because I think it's the beginnings of what you're asking for, but it doesn't completely cover it. And I think it is a very good point. Happy to hand over to others who may want to respond.
Does anybody want to respond? Okay, thank you, Jeff, for that. Councillor Robinson.
Yes, thank you. Good morning. I have 3 questions. I think my first question might be for Christine. It's about the structure of the plan we have in front of us today. And I must say, I'm beginning to feel a little bit disappointed that we don't have a chance to see the longer 75-page plan, because for one thing, you're having to spend time telling us what's in it. But I think if we were to weigh up the plan, just reading the condensed public one, perhaps for this committee isn't fully useful. I can see Julie nodding next to me on the screen. So one thing about the structure, I noticed the page layout, I've got like an issue and risk box under each setting, and these often include hurdles identified. But in terms of the one for schools on page 15, it seems under issues and risks, it just lists useful actions that are in place already to aid schools, like advice has been sent out on this, LAs have provided a template for that. Now, to me, those are actions done to date. They're not risks or hurdles in terms of meeting the aims of the plan for schools. And so it's left me wondering what the potential hurdles to be aware of are particular to the settings of schools. This version of the plan doesn't summarise that. So as a teacher, it doesn't leave me feeling reassured that those hurdles have been identified. My second question is probably for Liz. On part 8, it's roughly what number of cases counts as a surge. You know, when is a surge, and you know, how many number of cases will take us from that level 1 to the level 2 identified, where it says we'd need extra resources and capacity. So what kind of capacity, what number of cases can we cope with at level 1 before we've got to move up to level 2? And then finally, which is perhaps a question for Dillian, I see we're getting £1 million here in Peterborough, but I don't know how much a plan like this costs. So in terms of costs, how long does £1 million last us if we were to carry on at level 1? You know, how many weeks can we cope with the level 1 response if we've got £1 million to spend? Thank you.
I'll do it in reverse to give Liz a thing. Gillian, would you like to crystal ball gaze on the third question?
Yeah, I think the questions on finance are really important questions, actually, because you know, it's good that we've got money attached to this plan, and it's good that we are going to start to identify, and we've already started to identify kind of the resource that we need to implement the plan. And it gives us that bit of breathing space, I think, to start to really put together a financial plan that goes not just for the next few weeks or months, but probably longer than that, because we know this is going to be around for some time. So what I'd say to you is that you've got a good team who understand, if you like, the complexities of delivering a plan like this and the resource that's required. And what we will do is we'll spend the money that we've got, but we'll be starting to put together lobbying information and also projected spend that we think we need in the short term, medium and long term. And that's where we will then use what we did during the time of the response phase of the pandemic, start to lobby in the right places. So you will definitely, we will definitely know what we need as we move forward. And that will be part of what we use to lobby government for some more resources. We already got resources in the system that can be deployed. It's that extra resource that we will need to identify. We don't know whether we're going to have a large outbreak, and if that happens, as Liz said earlier, we would immediately get together and we'd start to put a financial plan if we didn't have the local resources. So my view is good start, good money that we've got. It's given us a breathing space to plan going forwards, but we will have to do that and start to put together some more longer term plans. And we will be doing that not just as one system, we'll be doing that across the whole country. And fortunately, we've got a strong regional team that will help us in that too.
Wendy, do you want to take the education one?
Yes, John, I'm happy to take that. So I have to say there is some very good evidence that some schools have had an outbreak of COVID and managed it incredibly well. And John Lewis, the Service Director for Education, works with each individual school when there is an issue, which I think you know, Councillor Robinson, because John's talked about it in the past. And if additional resources have been required, he's made sure he's got that from his resource and his schools team. So I actually think the schools are probably the most able to deal with this new system, given the fact that they've had to do lots of different things during COVID. I think if people are identifying additional support that schools need, then by all means, make sure you contact me.
Can I just come back? I think my question, I might not have said it well. I think it's been a little misunderstood. I agree with Wendy. I think schools are actually very well placed, and there's lots of great stuff being done. My concern is as to the document doesn't, in the issues and risk box, doesn't summarise well the issues and risks like it does on the care home page and so much, which is why I thought my question might be better suited to Christine, because I'm not concerned that schools don't know what to do. I was just concerned that it's not well summarised in the document.
I'm sure you'll pick that up, Christine, yeah?
Yeah, I'll go back to the education work stream who actually put that together, and we can make it clearer.
Okay. Was there another part to your question, Councillor Robinson?
Yes, it was a question for Liz about when does the surge count as a surge, and how high is it got to be for us to go to level 1 to level 2 where then the extra capacity is needed?
Yeah, and that's a really good question. So thank you for asking it. So we work in the local authority and the local health system as part of a wider system with the Public Health England Health Protection team. So one of the things that we observed in various phases of the pandemic to date was that, for example, when there started to be a large number of care home outbreaks within a short space of time, the contact channels into the health protection team, which normally do the initial risk assessment and follow up for those outbreaks, started to be very crowded. And what we would really be talking about, I think, in moving between level 1 and level 2 is not just about our internal, in a sense, local number of cases. It would be about a system where we needed to take the pressure off the regional health protection team because they were getting a great many calls. And of course, they service the whole region. And that was what happened with care homes, actually. They started getting an awful lot of calls. It took longer and longer to get through. So they wrote a standard operating procedure with local authorities and local CCGs to take a lot of the load of the care home work, in a sense, so that it got joined up between the what Public Health England was doing and what CCG infection control teams were doing, which actually was already happening and was sometimes duplicating. So I think we're not talking about a simple number of cases as the threshold between level 1 and level 2. It's more about the system as a whole becoming overloaded. And at that point, we will need to actually do more within the local authority, public health and local system outbreak management, because the regional tier will be able to do less and will need to hand off more. So what we really need on this, and we're pushing for this, is regional modelling around surge, so that we are able to model as a system, and that we will feed. We've asked for that. There is regional work going on. Our information analysts meet on a weekly basis with Public Health England intelligence team, and that modelling will feed into the detailed thresholds in our surge capacity. But in the meanwhile, we have a good, in a sense, qualitative knowledge of what will happen if the overall number of outbreaks goes up, and that will actually put more pressure on our services. We will have to do more for those outbreaks. I hope that's helpful.
Thank you. Thank you. Val Moore.
Thank you very much. At Health Watch, we've been hearing from people who have been shielded or vulnerable in some way, and listening to their experience of the past weeks and months. The report talks about risk assessments of care homes or workplaces or various other matters, but doesn't really talk about risk assessments for individuals. And for example, taking into account not only their own characteristics, for example, if they were from the BAME community, but also their specific medical history or the family that they live with or their mode of transport to get to work, the circumstances in that regard. So, and this matter was mentioned on the national briefings about there would be a clinical tool that would support this dialogue for a more precise information and understanding to be obtained by individuals so that they can manage their behaviour going forward and make the choices about isolation or social distancing or PPE, etc. So what I'm worried about is that the potential burden on primary care around this approach, where clearly the GP or occupational health at work would probably be the two main ports of conversation for that, but much liaison is going to be needed with the specialists involved in people's care. And I think for this to be up and running effectively as soon as possible, it would be really good for people that have been increasingly stressed and concerned about this and be worried about going out in a more hazardous environment externally. So there's probably a work stream around this or needed if it's not already been thought about in the plan, because I think putting individuals at the heart of the understanding of their risk and being supported to do that is going to be absolutely critical for many going forward.
Okay, Liz, are you able to take that?
I'll take it initially, certainly. And Val, yes, I'm also aware of that national briefing and the proposed clinical tool, which Gary Howsam may want to comment on if he's at the meeting, about how that would work. I do absolutely agree with you, Val, that this is a very important piece of work and that we need to have a clear approach to it within the local NHS. Whether or not it is a feature of the local outbreak plan, I would question slightly more, in that this is about prevention, identification and management of outbreaks. And I think what you are talking about is supporting people to manage their individual risk, which there are definitely overlaps. It's a Venn diagram, but you may not, it may be better to do that within an NHS clinical plan in a sense, supported by the wider public sector, rather than trying to shoehorn it into this particular plan. But I absolutely agree with you. It's key to managing the pandemic going forward is people having that good understanding of their individual risk and making those personal decisions. I don't disagree with you at all. But Gary may be well placed to comment further on what's happening in his world about this.
Gary, do you want to comment?
Sorry, Chairman, just to interrupt. Dr. Howsam has had to leave the meeting to attend to clinical duties.
Okay. So I'm sorry, Val, you're not going to get a complete answer here.
I think the fact that those people around the table in the engagement board is important, but the discussion will have to cross over into the terrain of the NHS plan as well as this plan. I feel very much about that, but yes, we'll see how that unfolds. Thank you.
Thank you, Val. I seem to have lost Councillor Walsh. Have you put your hand down, or have somebody decommunicated you?
No, thank you, Chair. No, what happened was I momentarily lost connection and I'm back, but my hand is up, if I may.
Yes, it's your turn. It's your turn.
Thank you. Okay, well, I'd just like, thank you. I'm a little bit off time here. It must be the connection on my part, so apologies. I'd like to first of all echo the views expressed by others that this public report is clear and very well presented. And I'd also like to agree with a comment that success so far has been based on public response. People have chosen to do the right thing. I wanted to express a concern that I have on page 14 of this report, the right-hand side, I'm assuming that this is going to be one of the resources that is put out maybe in the form of a poster that will be extracted from this report and made available to be put up in various settings. The thing that I worry about most, I think, is the compliance bit right at the very bottom, that if you have come into contact with someone, you must isolate for 14 days. Now, you might go have a test after 3-4 days. You might find out that it's negative. And so you might feel, well, I'm in the clear. Why do I need to complete 14 days of isolation? So I put that out because I think I can see that there will be people saying, well, my household has stopped isolating, because if you look at this poster, that's what it says. They're all out and about. Why am I at home? And I've just tested negative for COVID-19. What is the reasoning behind that? So I am concerned that we will get lack of compliance around that unless somehow we can communicate the whys as well. Thank you.
Okay. Liz, or do you want that to Christine?
Perhaps I could start and then hand on to Christine. So the explanation for that is very clear, as I'm sure you know, Councillor Walsh, which is that if you are in close contact with someone who has COVID-19, you're at risk of developing COVID-19 for up to 14 days after that close contact. So you may not have a positive test until 14 days after that close contact. And if you pick up a cold or another virus in the meanwhile on day 3, you may have that cold or other virus, but you are still at risk of developing COVID-19 symptomatic up to 14 days. The fact you've had another little bit of an illness in the middle doesn't make any difference. So the risk is still high, and that is why the person needs to continue isolating. The other people in their household were only exposed to the cold that they got on day 3, so they don't need to isolate. So the science of that is fine. But you are absolutely right, it is incredibly difficult to explain. And I think we need to explain it to the people in the households. We also need to explain it to workplaces so that they don't think that a negative test is a reason for someone to come back to work if they've had close contact and need to self-isolate for 14 days. So I agree, it's a huge communications piece. And I think at this point, I'll hand on to Christine, who is our communications expert, because it is a challenge.
Hey, you are, Christine, you've been elevated. You're now an expert. She's not an expert at tuning in though, is she?
Hang on,
No, you've lost you, Christine.
sorry, my unmute button was stuck. Have you got me?
Yes.
Have you got me still? Okay.
Yes, yes.
The page that counts, the page that Councillor Walsh is referring to actually relates directly to the test and trace document, which is another public-facing document, which has got quite a lot more detail on it. And that's also going to be updated because I think there's some changes to the information about why people should be asked to isolate. And we always knew that that would be a document that would be updated very regularly. So yes, there will be more information on the other document, which is referenced on that page, and there's a web link, and we will be making posters about that as well.
Thank you. Does that answer your question, Councillor Walsh? Okay.
Sorry, Chair, I'm very sorry to say, lost connection completely, but I'll take the rest of the answers offline with the officers. And thank you.
Thank you. Just Councillor Nikki Massey.
Yes, thank you. Some of my questions actually were in a similar vein to Councillor Walsh's questions, but it's more about enforcement. As time is going on, we've all seen it. We've seen it in Cambridge City and in Peterborough, that people think that social distancing basically is non-existent nowadays. Therefore, if social distancing is non-existent, I'm pretty sure that quarantining is going to be harder as time goes on. So therefore, we need to think about what measures of enforcement that we have to try to make sure that those who are quarantining are actually doing so, and what enforcement measures we can do if they decide to not abide by those rules. The other, I've got 3 questions. So the second question was in regards to what we class as numbers of outbreaks. If we're only talking about pillar 1 tests, which is the people who are quite sick and have gone to hospital, is that all we're looking at in regards to the outbreak numbers, or are we going to get the data for all the GPs who say that currently I've got people coming to me saying they've got symptoms of COVID, but they're testing negative mainly because they've been tested 4 or 5 days after the first symptoms. Therefore, they are being treated as COVID positive. Are we taking those numbers into account when we're looking at the numbers for a potential outbreak? And again, test and trace, are we going back to test and trace on those people who maybe have a negative test, but all the signs are pointing to COVID, and it may just be down to the delay in testing? The third question is in regards to the document and the membership of the member-led engagement board. I understand that it is based upon the Health and Wellbeing Board core joint subcommittee, but however, the South Cambridge District Council is represented on there, but not Cambridge City. So I'd request that we are, please.
Okay, before I hand over to that, there was a discussion which we're involved in all the districts, because there'll be 7 districts, and they all agreed that there'd be 1 representative, and local representatives were brought in as and when there was an outbreak in their area. So it was a joint decision to do that. Do you want to do test and trace, Gillian, or do you want Liz to do that?
Liz needs to do that, Councillor Holditch.
Okay, Liz.
So yes, I think Councillor Massey makes a good point about social distancing and having concerns about it not being followed. Again, this comes down to our communication strategy in many ways, about whether people will quarantine, whether there's social distance. So we do outline that in our plan, and it is very much about encouraging, engaging, explaining, so that we continue to communicate with our community about why it's important to quarantine, why it's important to socially distance, because nobody wants a second wave. But enforcement is at the end of that chain of actions, and our enforcement measures are relatively limited. We do have some. So under the Coronavirus Act, a public health officer, which would be a Public Health England consultant, could require someone with symptoms to stay in a place of safety for up to 48 hours. Probably the main local measure that we have is a Section 2A order, which needs to go to a magistrate, and you can use those to either enforce quarantine on an individual or to close a premises. You can take quite a wide range of action under the relevant Public Health Acts. So there is the possibility of enforcement. It's time consuming, and seeing the ways that our community reacted previously and seeing some of the impacts that COVID-19 has already had on our communities, we do need to continue with that communication, both locally and nationally, to, as far as we can, ensure that people do observe what needs to be done. So that as with so many things, all that comes back to communication and engagement. I think inevitably it can be problematic if people get their tests too late on in their symptoms. And the best way to deal with that is to get the message out about getting your test early when your symptoms start, so that people have the test within the first few days of their symptoms, first 3 days, and are most likely to show positive. Because it is difficult. The national data are showing that 1 in 1,700 people have COVID-19 at the moment. So there will be many people with symptoms who have something else. And some of those negative tests will be correct. So we do just need to make sure that we make our communications, our engagement as good as possible. And yes, enforcement is a last resort, but it's not going to be an easy option. Is that what you need, Nikki? I hope it helps.
Could I add to what Liz has said? Councillor Holditch, please. Yeah.
Yes,
I think one of the themes that's come out of this meeting, which I think is really important, is the issue about where the community and voluntary sector sit within the whole of this plan. And I think what we learned through the response phase of COVID-19 is how that community, how those voluntary sector mobilise themselves. And it could go down to small groups in a village, it could come down to a voluntary organisation, it could come down to individuals. And what we found is the willingness and the ableness of that sector and those individuals and those groups to carry messages, communication and engagement with local people. I don't think it's going to be any different, except probably for the fact that we're going to have to work harder on this. Because it is true to say that the message that's gone out is that we're open for business now as a society. Yet what we know is that COVID is still in the community. And that has led to people being prepared to go out and not probably recognise that they need to be as vigilant and as careful now as they were in the first phase. And we need to use that massive army of people, all of those willing people, to carry forward the messages that we need to get out. And it's not just messages, it's engagement and it's supporting us. And that's exactly what I'd like to see in the next few weeks, is us getting together with key representatives, with those that we did mobilise, to really start to work out how we target our work, how we target our communications, and how we ask to do this, because we need to restate the position. We need to re-emphasise the importance of all of this, and that's part of our prevention strategy. So it's really good to see that so many of you recognise and understand that, and my commitment and that of the team here is to do that, and to do that over the next few weeks. And I'd like, as I say, I'd like to see a meeting where we do that and where we start to re-energise all of that massive support and good work, and get this focused on what we need to do within the context of our outbreak plan. So thank you for all the offers and all the questions and all the challenge. It's been well made and it will be picked up, and we will absolutely run with that, because that is going to be what makes this a success, I think, at the end of the day.
Thank you, Gillian. I think that covers your questions, Nikki, on that.
Just about the pillar 1 testing, whether that it's only the pillar 1 testing that's going to count as to whether or not we've got an outbreak, or are we looking at the data from the GPs who are treating patients as if they've got COVID because they've got all the symptoms, etc. Will that data be used to look at whether or not there's an outbreak? Because my concern is, if we're only going to wait for the outbreak to hit the hospitals, we might be a bit late.
I can reassure you, Councillor Massey, that we are using Pillar 2 data, which is all the national testing systems. Absolutely. A lot of the data that is coming in to us is from Test and Trace Pillar 2 and so on, and that is used to identify outbreaks. It's not just the Pillar 1. So we are absolutely using that data. In terms of the GPs, if people haven't gone for even a Pillar 2 test and it's just symptoms, that's more challenging because there are other respiratory illnesses around as well as COVID. So it's not as definite as the positive cases, but we do monitor in the surveillance cell through the CCG some of the 111 calls on relevant symptoms and so on. So that is soft intelligence, but it's harder intelligence to act on because you do have quite a lot of other viruses which could cause the same symptoms around.
Okay,
that's helpful.
I think that does it, Nikki. Councillor Fitzgerald.
Thank you, Mr. Chairman. Morning, everybody. Just building on a little bit of what Gillian was talking about and a number of other things, comms, but I come at this from the person in the queue at Asda that I see on a Saturday. I wouldn't want to think any of our plans are panaceas to cure all the issues or solve all the issues surrounding COVID. And Christine, also, I do pick up on your points about changes to the information required. I mean, having a quick check through on the website, it refers to 2 meters, obviously, in all the published documents, which need revising, which brings me on to the point. Is the system, not our plan, but is the system not flawed with the failure to introduce the app to trace? I'm confident about testing, but how confident should the public be in terms of tracing? I mean, I've read the text over and over, and I have to say it's deliberately woolly, because that might be that it's got to be that way, because all the talk of the app, and as far as the public is concerned, that we were led to believe if you came within contact of somebody, you would be contacted. But that doesn't seem to say that now in our messaging. Now, there's a lot of criticism of government about 1 metre plus and all this other stuff, whereas this is our local plan. My own personal view is stay the heck away from people if you don't have to go near them. It's as simple as that. And that's what we should be saying. If you don't need to go near somebody, stay as far away from them as possible. That's 1 metre plus, but yeah, don't go near them. So from a public health perspective and comms, how do we convey that actually, and Gillian, it's your point about building upon the messaging that we've done and reinforcing that it's not gone away, it's still very much a live issue, that we need to, because there is this air of, you know, in the national news and everywhere else about people kind of saying, oh, it's not so bad now, we don't need to worry as much. I think we do need to worry as much. So encourage people to stay away from each other. Do not go near anybody else unless you have to. Yes, fine. The government's relaxed 1 metre, we know why, but our messaging and our public health advice should be stay the heck away from people, because I'm not confident of the tracing aspect. And I'll come back to where I started. So if I'm in the queue at Asda and somebody in front of me goes and tests and trace, how are they going to trace me? Because it seems to be saying that they're going to trace from your contacts. I don't know the person in front of me. So we can be sending out a message that, don't worry, you're going to be covered, we'll contact you. I don't think that's the case anymore, unless you're going to tell me something different. But that's not what I'm reading. And if that's not what I'm reading, then it's wrong. I'll shut up.
Have I got a guarantee on that?
What, shut it up or being wrong?
Both. Right, who's going to take that? I think most of it's addressed to Gillian, wasn't it?
Well, public health for Liz in terms of what is the messaging,
yeah,
and in terms of the tracing, not our fault, but are we somewhat weakened by the failure to deliver this robust app, or however we're doing it? I just don't see it at the moment. I'm confused.
Okay, thank you, Wayne. I'm happy to take that in terms of the public health messaging. And I have to say that I entirely agree with you. And I think that the Chief Medical Officer would agree with you as well, that our messages should be about staying 2 metres away from people if we don't need to go nearer. So the 1 metre plus as if it's unavoidable in order to achieve some other things which our society needs to achieve. But absolutely it should be stay further away, stay at the 2 metres. I would certainly agree with that, and that we need those social distancing measures and messages to be absolutely clear, because this virus hasn't gone away. And we are seeing that internationally. So entirely in agreement, Wayne, with the messaging that we should be putting out locally. And I'm really pleased that you support that. In terms of the person in the queue at Asda, I think that messaging is really important.
By the way, other supermarkets are available. Yes,
okay. In terms of that, I think people need to understand that when they are queuing, they should be social distancing, and they should not be making themselves into a contact. And actually, then it doesn't matter whether you've got the app or not, because you are not putting yourself close enough to someone to be a close contact. That's a message which has gone out quite strongly in the health and social care settings to staff, that if you do all the right things, you won't have to take your team out of the workplace because you won't have been a contact. But we kind of need to get those messages out publicly, and you're absolutely right. In terms of a public health perspective on the app, what I would say is that contact tracing is a very well-established public health procedure, telephone contact tracing. Some other countries have used apps, some other countries haven't or are only introducing them now and have managed to do a good job. So we can do a lot with the telephone contact tracing system that we have, the internet contact tracing system. The app would add. There have been issues with apps where they've been used internationally. In some countries they've worked well, in some countries they haven't worked so well. So it's definitely something else that we would want as another tool in the toolbox. But there's a lot that we can do without it. But I do quite agree with you around those sort of more random contacts. Then we really need to be encouraging people not to allow those random contacts to happen when we don't have an app that would identify them. But there are other measures like taking the names of people who go into settings which are being talked about, so that you can contact trace from settings where people have been close together. If you give your name when you book the restaurant, go to the pub, whatever. There are other things that can be done. But I do agree with you that in the absence of the app, it's even more essential to get the message out to people. Please don't make yourself into a close contact in the first place. Does that help?
I think that's a very comprehensive answer.
Yeah, I'm happy, but as I say, if we are reinforcing the message that it's okay to be more relaxed about it and get close to people, I don't think it is. I understand the economy issues and I understand why government is doing it, and I agree, but locally this is our plan, and our advice, or public health advice through you, Liz, and the elected members and others is, yeah, stay the heck away from people. Don't go near anybody unless you have to.
I have to say I agree with you, Wayne. Happy to, and I think that we do need to balance things. Our children need an education. We don't want to prevent that. And children are not at high risk, so there is always a situational perspective and a balance between the different objectives that need to be achieved. But I absolutely agree with your messaging locally, that we should be getting that message out strongly. So no disagreement there at all, and I'm quite happy to say that and work with Christine on it. Thank you.
Christine, do you want to add?
Yes, just to say that we have actually been commissioned by the SCG last week as a whole system to come up with just that campaign, which we have done. And we've got some stuff to roll out for the SCG to sign off this week, which is absolutely on the message that COVID has not gone away, and that it doesn't matter what the distances are that the government is promoting. Actually staying apart, whether you're inside or outside, reduces your risk. And there's a whole range of those sorts of messages that we're just working up, and we should be ready to go this week on that.
Must be psychic.
Okay. Thank you, Christine. Now, look, we're starting to go around again. We'll be here all day for that. Susan, this is a new question.
If it's all right, I think I think the matter of community and local communication has come up throughout the meeting, but I'd like to be sure that we're going to see how our concerns will be reflected in the document. But also, I don't feel we have a clear answer on reaching what we call community leaders and community groups. So the specific question is, what should the COVID community groups be doing now? They haven't received any clear guidance at this juncture in time. Some of them are winding up. So there's the potential to lose that resource, and they are communicators. They disseminate the messages that they are getting from the county-wide hub. They are, they have money to distribute flyers to every house every 2 weeks. They are going to stop this work unless they know that there's a clear role for them. So I, as a coordinator of one of the groups myself, I haven't received anything. And there is a directory on the Cambridgeshire website for all of our groups, but how has that been harnessed? What is happening there? And then the other clarity I would like out of this meeting is for the role of counsellors. I mean, this is our job in our communities to be communicators. It's not clear to me what sort of practical marching orders you're going to be sending our way. At some point you've mentioned community champions. We don't have community champions in every district, but why not just go directly to counsellors? I just don't understand. We need a much more powerful connection to the community, and there are resources there that we should be taking advantage. They are waiting, people are waiting to help. And I think, following on from what Wayne said, people want this to work, and we all have a role to play, and we can do more if you can bring us at most local level much more clearly into the plan.
Gillian, I think you ought to take that one.
Yes, Chairman, thank you for that. And the commitment I gave in the earlier answer is there. So we've already we've got a workshop tomorrow, which is going to go through in detail the whole of the kind of operational plans. But the commitment is to draw people together to finalise that kind of plan to get the community engaged. And that's councillors are at the heart of that. They're at the in fact, they're at the forefront of that, in my view. What we had to do today was get a plan together to publish tomorrow. The next stage is to mobilise the support around that plan, and that is the commitment I gave earlier there. It's a serious commitment, and we'll be coming out to you in probably the next week with actually how we're going to engage with it and get this really massive resource that we've got out there mobilised to support this outbreak plan. So it's coming, Susan. Just keep hold tight and wait. We're not going to let you demobilise people. We'll be out there with you with how you can work with us, because this is our plan, this is our response, and this is everybody, and with councillors, with people like myself, with Liz at the forefront as leaders, but engaging our communities who've done so much to help us get messages out, to support people who are vulnerable. That still is going to be in place. So we're ready with that. We'll be coming out to you, and the commitment is there to probably build on what we've already got, because this is a different thing to just shielding. This is more complex, but it is absolutely at the heart of what we need to do within the community. So sit tight, wait, we'll be in touch.
Councillor Hoy.
Yes, thank you for that. I just totally agree with what Councillor Van der Ven was saying. Actually, a lot of the community groups are actually starting to wind up a bit, and I think the danger of what you're saying with the plans that you're making about sort of, you were suggesting that we were going to be giving people saying contradictory to the government advice and saying that we must advise people to stay away from each other. There's a very real danger of scaring a lot of members of the community, and what worries me is that we're going to perhaps frighten a lot of members into the community who are then going to try and access support, which we then can't deliver because a lot of these groups have wound up. So I do think that's actually a really good point and something we need to consider. And also, I've said this right from the beginning of the pandemic, and I'm going to continue to say it. What worries me the most is the actual other stuff that we aren't seeing, a lot of the family issues, a lot of underlying health concerns that people aren't raising. And I was very scared at the beginning that actually the consequences of what happens that aren't virus related could potentially be more damaging than the actual consequences of the virus itself. And I think we need to be thinking about that and really planning on what we're going to do, because we need to be getting these kids seen by social care. We need to be getting people reporting going in, and if they've got cancer problems and other symptoms, going into A&E, because the A&Es are just empty, and we all know that. So people aren't going in, and it just worries me what the knock-on effects are going to be. Thank you.
Thank you, Councillor Hoy. That includes all the questions I have. I think you would agree this has been taken a very good plan and improved it immensely, and I thank you all for that, and I'm sure the officers do as well. But you made some very, very good comments in there, and the recommendations you'll set out is to consider and comment on the plan, which you've done in spades, and require the local outbreak member-led board. And does the board agree that these recommendations, if there are any objectors, please raise your hands, because I think we've taken into account everything you said. So is anybody against approving it with the caveats that you've already made? I don't think I have any objections, do I, Paulina?
No, none at all, Chair. Thank you.
Well, thank you very much. I think that's been a very good meeting. Thank you very much for your comments. Thank you. Covered everything, Pauline, I think.
Yes, that's good. We can switch the live stream off now. Thank you.
Thank you.
Meeting is closed.
Thank you.